I think my pregnancy is ectopic.
The only way you could know that for certain is via sonogram. And if the doctor saw an ectopic pregnancy, you wouldn't think, you'd know.
I haven't had a sonogram yet. I just don't know what I'm dealing with.
An ectopic pregnancy is when the embryo implants in the ovaries or fallopian tubes instead of in the uterus.
I knew that much.
When the embryo first implants, you don't know. It is the symptoms when it is growing beyond what your body can handle.
That's what the uterus is for, to hold the growing baby.
When the embryo is growing elsewhere in the body, it starts putting pressure on tissues that can't grow and expand to accommodate it.
What are the symptoms of an ectopic pregnancy?
One symptom is a pain as the ectopic pregnancy presses on surrounding tissues.
Sometimes it seems like everything hurts, from breast pain as that grows to various tendons shifting.
Ectopic pain will cause growing pain as it puts more pressure on the tissues, and it will eventually feel like you have appendicitis.
Appendicitis is life-threatening.
Yes, and so is an ectopic pregnancy, except it won't cause infection.
What does it cause?
Internal bleeding. And you can have other symptoms like light vaginal bleeding.
That could be a sign of a miscarriage.
A miscarriage will cause severe pain too, but heavier bleeding that you actually see. An ectopic pregnancy is more likely to cause lightheadedness or fainting, too.
Severe blood loss can do that in any case.
Shoulder pain is another symptom.
That sounds weird until I heard heart attacks can cause shoulder pain and jaw pain.
Heart attacks will cause nausea, lightheadedness, pressure due to the circulatory system problems. The similar symptoms occur with an ectopic pregnancy, depending on where the blood pools.
Man, that sounds bad.
Some women feel like they need to have a bowel movement as pressure is put on the digestive tract. It can feel like bloating and water retention.
Except water retention is solved by drinking more water and less soda, while bloating can be solved by eating more fiber and letting the gas pass.
And water retention and bloating are normal in pregnancy.
I wish there was a way to tell if it was a miscarriage or ectopic pregnancy or something worse.
If you took a pregnancy test out of concern you were having a miscarriage, it would still show positive, though it can't continue. If you had bleeding for a miscarriage, it is usually because the embryo failed and pregnancy hormones are dropping.
So if I have minor bleeding and pain and the pregnancy test is negative, I'm miscarrying. But if there's growing pain and still pregnant signs, it is ectopic.
There could be other reasons too, like an untreated STD turning into a severe infection.
So everything that could be wrong is a reason to see the doctor.
If you think you're having a miscarriage or ectopic pregnancy, it is a reason to visit the emergency room, not just the doctor. And if you're lucky, everything is fine and you can come back to maternity in 6 months.